Hello and welcome back as we continue our exploration of cardiovascular physiology. And in this section, we're going to learn about the tropies. These are all words that end with tropy, not trophy, but tropies. And there are 4 of these. Now, the good news is out of the 4 tropies, you've already learned about 2 of them. So what we've already learned about previously is the chronotropic effect, which has to do with a timing, where a positive effect is a speeding up of the heart rate and negative effect would be the slowing of a heart rate. And we've also learned about inotropic effects, where a positive inotropic effect would be a more forceful contraction and a negative effect would be a less forceful contraction. So now we're going to learn about the other 2 things. And those are dromotropy and lusitropy. So starting first with dromotropy. Dromotropy is referring to the speed of conduction going through at the AV node. So yes, dromotropy is going to be related to chronotropy as well. And then the second new term is lusitropy, which actually has to do with the speed of myocardial relaxation. So during diastole. And if you recall, cardiac muscle relaxes by the calcium uncoupling and going either back into the endoplasmic reticulum or exiting the cell. And it is the calcium in the cytosol, high levels of calcium in the cytosol, which give us that plateau or that prolonged contraction. So the rate of relaxation affects the length of the plateau, which affects how long the heart muscle is refractory. So when we look at our nervous effects on cardiac muscle, so this is a similar picture to one we showed previously, which had to do with blood vessels, but this one has to do with cardiomyocytes. And we have sympathetic nerves, which are using norepinephrine as their neurotransmitter. And so the ones that are important for the heart muscle are the beta 1s and beta 2s. And then we have parasympathetic nerves, which to the heart are through the 10th cranial nerve, and they're using acetylcholine for their neurotransmitters, specifically muscarinic type 2 receptors. And so generally, sympathetic gives us positive effects for all 4 of these tropies, and the parasympathetic effects would be negative. However, realize we cannot have a parasympathetic effect take us below baseline when it comes to inotropy. So looking at chronotropic influences, in other words, things that are increasing the heart rate, as we all know, plasma epinephrine, norepinephrine increase the heart rate, as well as direct sympathetic nervous stimulation of the heart or decreased parasympathetic stimulation. Since parasympathetic stimulation lowers the heart rate, lowering parasympathetic stimulation would actually raise the heart rate. So in order to get a positive chronotropic effect, i.e. a faster heart rate, we would have more sympathetic effect, we would have more epinephrine, norepinephrine, or we would decrease parasympathetic effect by decreasing acetylcholine. And so nothing major new on this slide, we're just putting pieces of the puzzle all together. Now, in addition to that, there are some hormones that can change the heart rate, either positive or negative, depending if the hormone levels go higher than normal or lower than normal. But unless somebody has one of the disease processes that cause this, when we're talking normal physiological responses, these are not ones that should be at the top of your list. And then the other point I want to talk about is that chronotropic effects. In other words, the heart rate decreases as you age. When a baby is first born, the normal resting heart rate is in the 140s, okay? And by the time you hit adulthood, well, by the time you hit college age, it's usually in the 70s, often closer to 80. And by the time you are older in in adulthood, it's usually around 72. But then once you start becoming middle and older age, it's going to drop down lower into the 60s and maybe into the 50s, kind of depending on what else is going on in your life. And we also see this with increase in fitness level because the heart kind of learns how to be more efficient from all the exercise. So the resting heart rate of folks who are more physically fit will be lower than their peers. So here is a DWAP for you to pause and 5 questions for you to answer. And when you're done with this, that's the end of this section. And I'll see you soon. So thanks for all your work in this part. I think it was pretty straightforward. Just a couple of new terms.